Today is an exciting day. I want to thank Secretary of Health and Human Services Deb Sangvi. I want to thank Jose Penabad from Undue Medical Debt. I want to thank Dave Almeida from Blood Cancer United for joining us today. And to the many people who made today possible, and a number of you are here in this room, I want to give a hearty word of thanks. I want to get right to the news because it's very good news. Today, we are announcing that thanks to North Carolina's Medical Debt Relief Program and the partnership of every single one of North Carolina's 99 hospitals, that over the past year, more than 2.5 million North Carolinians have had medical debt totaling about $6.5 billion completely erased. I'll say it one more time for the folks in the back. More than $6.5 million in medical debt for nearly 1 out of every 4 North Carolinians, an average amount of about $2,600 erased. So many credit reports wiped clean. This is life-changing news for so many families. Medical debt is a tremendous burden that keeps families from financial security and emotional and physical well-being. For many people, the debt service serves as an anvil holding them back from opportunity and a better life, from getting a mortgage or a small business loan. People often feel shame when they don't pay their debts, even when it is impossible for them to afford them. Unlike most other forms of debt, medical debt is not a choice. No one chooses to have a heart attack or get diagnosed with a chronic condition. You just have to deal with it. Today's announcement will free people from the financial stress so that they can focus on getting healthy. There are many people to thank for today's news. Chief among them is former Governor Roy Cooper. I want to thank Governor Cooper for caring about folks' financial stress and for his creative leadership. Last year, Governor Cooper and former DHHS Secretary Cody Kinsley put gears into motion by working to enroll every eligible hospital in North Carolina into this state's medical debt relief program. It was a first-of-its-kind initiative that leveraged federal health care money to incentivize hospitals to erase people's medical debt. Most of the debt had been on the books for years. It only served to deprive people who had no way of paying it back of a brighter financial future. If they could have paid it, they would have paid it. So we used an existing federal program that benefits hospitals to reward them for relieving this debt. Again, debt that they were not going to collect anyway. In addition to DHHS, the partnership could not have happened without the willingness of our state's hospitals to help their patients. So I want to say a loud thank you to North Carolina's hospitals and to the North Carolina Healthcare Association. I also want to acknowledge and appreciate Undue Medical Debt, the nonprofit organization that has been working with the hospitals and patients to make this debt relief happen. This medical debt relief program is a true win-win for the patients, for the hospitals, and for our state's economy. I'll let the other speakers say a little bit more about the announcement, but today I want to celebrate this good news and all the folks who worked so hard to make it happen, and I want to give a special thank you to North Carolina's Medicaid team. They have been working their tails off through incredibly challenging time put on their shoulders by the federal government especially, but also our state legislature. I hope that today is a reminder of how important the work that you all do at North Carolina Medicaid for the good of the people of this state. The program blew past the impact we anticipated when we got started by billions of dollars. It's an example of innovation and collaboration to improve the health and economic well-being of the people of North Carolina. That's exactly what people want out of their government. We can do it again. That is why I am calling on the Senate and the House to put their non-Medicaid disputes to the side and come back to the table to fully fund Medicaid in North Carolina. The two chambers agree that Medicaid needs more money to operate. The two chambers even agree on how much more money is needed to operate. The two chambers agree that the cuts to Medicaid provider rates are hurting people, especially in our rural areas. The General Assembly needs to send me a clean Medicaid bill when they come back to town in a week and a half, and I will sign it. In Washington, D.C., our leaders from both parties need to come together to extend the ACA subsidies and stop people's health insurance premiums from skyrocketing, 60% on average. We have so much work to do to improve people's health and financial well-being, but this announcement serves as a reminder of how much we can achieve when we work together. You'll hear stories from Jose and Dave about how this debt relief is benefiting North Carolinians. People like Michael and Deanna, who both faced life-changing medical diagnoses and then life-changing debt just from trying to get treatment to stay healthy and alive. People who now have a chance to get their health and their financial lives back on track. So let's keep this momentum going. Let's keep putting money back in people's pockets, not leaving them high and dry. Let's keep investing in people's health. I'll now bring forward Dev Sangvi, Secretary of DHHS. Dev.